and welcome to my channel. So this video I'm doing a little different today. Um, Normally I post my Sensi videos as a Sensi consultant, but this video I do want to talk about my other day job, during the day. I am a certified medical assistant Monday through Friday. I've been a medical assistant for 8 years. I graduated from Sanford Brown Institute back in um, August of 2014, and got my foot in the door with a pediatric dermatology office first. Then I was there for about a year, but then I got to work in neurology, which was really interesting. Learned a lot, um, but I wanted more. I was with neurology for probably a good 3 years, but I wanted to do more, learn more, hone in on my medical assistant skills, vaccinating, EKG and whatnot, all that fun stuff. So I went into family medicine, and I love it. I love it. I went into family medicine. I've been in family medicine for I want to say it's been about 4 years. Yeah, it it's been almost 4 years, or I'm going on 4 years, I should say, with this company I'm at. Um, but due to healthcare and patient privacy laws, aka HIPAA, we all love that famous patient privacy laws, HIPAA. It's very hard to do a day in the life and show what you do in the office with a video camera. It's very hard to do because you have to be careful not to take videos with patients, because of HIPAA. Very big patient privacy. You can be fined or whatnot. Yeah. So I'll just talk about it. Talk about what I do. I work Monday through Friday, 8 a.m. in the morning to 5 p.m. Also depends on my class schedule. I am going back to school to further my career. But anywho, that's probably another video if you would like to hear about myself working a full-time job as a medical assistant and going back to school. Post a comment down below if you want to see that video. But anywho, I work 8 a.m. to 5 p.m. Monday through Friday. So once I walk in, after I clock in, I have to, if I don't make it at home, I have to stop by, make a nice size cup of coffee. I have to have my cup of coffee in the morning to kind of give me that boost and wake me up. Be like, damn, bitch, wake up. Okay. So I take my coffee, go to my desk, put my stuff, my purse in my drawer, my coffee in my cabinet. Because you're not supposed to have coffees out in the open. Put my coffee hidden in the cabinet. So I'll turn my computer on while my booting up. What I will do, I'll go ahead and go into my exam rooms and turn everything on. I'll pull a fresh sheet of table paper on the exam table so it's all presentable and ready to go for the first patient. I'll make sure my exam rooms look presentable, nothing on the floor, make sure that everything's all clean. And then I'll head back to my desk, bring up Um, the program that we use Epic. Um, I will print out my schedule. Usually I try to print out my schedule the day before, or towards the end of the day before, in the evening before I leave. I try to do that. Sometimes I might not be able to if it's busy, but I try to get it printed out the day before. Um, but I'll go through my schedule, go through the schedule, and look to see what we have. I'll make little notes on my copy of the schedule because that's what I will use, so I can see where I'm at rooming patients. Um, I go through each patient, look through, see if they're a diabetic. I will write down, okay, glucose, so I know to check their glucose level before I leave the room. We do that with every diabetic. Um, if someone's coming in for some kind of urinary system symptoms like frequent urination, burning with urination, whatnot, I will make a little note. I'll just put like the word urine so I know to have that patient give me a urine sample before I put them in the exam room. And I will have the patient go to the restroom first before going into the exam room and getting their blood pressure. So then I already have the urine sample there and ready. So once I'm done getting all the vitals, blood pressure and stuff from the patient and doing the computer work, then um, I'll exit, put my little flags up by the door saying, letting the provider know that they're ready. I'll go into my little lab area, get my gloves on, and get the urine out of the cabinet, and we'll get a urinalysis dip running, so the provider already has the results before they go in. I also look through the schedule to see if we have any physicals, pediatric physicals. Working in family medicine, we see everyone from newborn all the way up to like old age. I mean, there's no set age limit, so I mean, all the way up to 80s. Some it's kind of rare for 90s, but 80 up until 80s. But from newborns all the way up until old age, that's family medicine. I'll also look at the schedule, see if we haven't see what physicals we have. Any pediatric physicals, um, I will go through the Florida Shots database and print out all the Florida Shot records, and the necessary Florida Shot certifications that the parents need for school. And I'll kind of make notes, not on the certification, but on the other list of all the Florida shots. Like I'll kind of like circle which ones are overdue or due. See what they're due for, so we know ahead of time. And then I'll look in the chart and see what their insurance is, because the office that I'm at, we see a lot of Medicaid patients, a lot of Medicaid pediatrics. So we do a lot of what they call VFC vaccines. They're vaccines for children, covered by Medicaid. It's just it's a Medicaid program for children to make sure make sure they're caught up with all their childhood vaccines. So I'll get all that printed out for the pediatric physicals. Adult physicals, I will look at If it's a female, I'll look in the chart to see, have they had a PAP? Um, PAPs start from age 21 and up. So I'll look in the chart to see if they've had a PAP. If they haven't, or if it's been over so many years, then I'll kind of make a note, possible PAP or with PAP, and I'll put a question mark. So when I room that patient, I'll I'll ask them, did you want to do your PAP with your physical, or did you want a referral for OBGYN? Because PAPs, women, all women, we have an option. You don't have to do your PAP with your annual physical with your primary care. Every female is different. Some women, they prefer to have a separate OBGYN. I mean, because they specialize in that area. They specialize in that area. So some women are just more comfortable with a specialist for that specifically. So it's all right. You don't need to. You don't have. No one should feel pressure to do their PAP with their physical, with their primary care. So yeah, no one should feel pressured. It's up to the patient. If you want a specialist like an OBGYN, that's up to you. Just let your primary care know. We can put a referral in for one. And so I'll go through the charts for adult female patients, look at if they're coming in for physicals. I'll go through the charts to see when their last PAP was, and if they need one, and make a little note on that. I'll look on the schedule, see if there's any pre-ops, make a little note so I know to check, make sure they have their pre-op paperwork, so we can see if they need EKG, labs, chest x-ray, whatnot. We do occasionally do depot injections, depot or medroxyprogesterone injections. It's another form of birth control. So I'll look through the schedule for those, and I'll make a little note. If there is a depot injection on the schedule, I'll make a little note, so I can get a urine sample, because we have to do a pregnancy test first every time. We have, even if they're on depot for hormone reasons, we still have to do a pregnancy test. I mean, as a medical assistant, we do a lot. We do vaccinations. We take the patient's vitals, blood pressure, pulse, temp, weight, height, all the fun stuff. We do EKGs when needed, if either for pre-op, or if they're coming in being seen for chest pains, or if they're having heart palpitations. Sometimes we might have to do an EKG for that. I like to be ahead of my provider, know what's going on in the schedule. My provider, his clinic starts at 8:30, so I have a little time from when I clock in before the first patient. I can kind of look through the schedule quickly and see and make notes, see what's needed and whatnot. And then as soon as my provider gets in the office, we do a little huddle. We call a huddle, because I I actually will print out 2 copies of the schedule, one for me and one for my provider. So we do our little huddle. I give him his copy, and we just go over the schedule. See, he might uh, give me a little pointer on something on the schedule. Oh, also on the schedule, we do see patients for medication management, mostly pain medication. So when we have patients that come in for pain medication management, we have to look through the chart, make sure they have an updated controlled substance agreement on file, signed. Um, every time they come in for their pain medication management appointment, we have to get a urine sample, and the cup has to be at least halfway full, because protocol, we have to send the urine out for drug screening. I mean, you see, it's just with family medicine, there is never a dull moment. Family medicine, you can see anything from skin issues to a blood pressure follow-up, hypertension follow-up, to diabetes follow-up. I mean, we see it all. Family medicine providers take care of it all. Trying to think what else. Of course, we also do phone calls, phone messages throughout the day, in between patients, when we have a little downtime, when we're able to sit down. I'll go through the my phone messages, and trying to work on those in between patients. That is part of our job duties. And phone messages can be anything from patients needing to schedule appointments, patients needing medication refills, regarding paperwork, you name it. I mean, it could be anything. It could be another doctor's office calling regarding paperwork. There's probably hundreds of scenarios what phone calls could be about. Could be patients calling in because they don't feel good and whatnot, blah blah blah. So we try to get as much information over the phone, like what their symptoms are, when did they start, what medications have they tried, or what over-the-counter medications have they tried. So it's, yeah. A medical assistant is kind of like the provider's right hand man, or right hand person, I should say. Most medical assistants are female, so it's a female dominated career. There's not a lot of male medical assistants, but um, men can be medical assistants. But being a medical assistant, you're kind of the provider's right hand person. You want to know stuff in advance, what's going on, before the provider knows, especially the patients that are on the schedule coming in. You want to know ahead of the provider what's going on, so you can have everything ready for the provider. I think I'm pretty much done. If you have any questions, suggestions, leave a comment below. Don't forget to hit that like button, subscribe, and if you want to see any other videos, if you want to see me do a video of myself talking about being a full-time medical assistant and going back to school, part-time, shoot a comment below and I will get that video out there. So hope to see you next time. Good night.